Good afternoon, everyone. My name is Siyu. I'm assistant professor in the Department of Landscape Architecture and Urban Planning at Texas A&M University. First of all, thank you for the invitation. Today, I will be discussing making room for the river, applying a plan integration for resilient scorecard to a network of plans in Nijmegen, the Netherlands. This project is funded by the National Science Foundation Partnership for International Research and Education Program. So the Netherlands is one of the most flood vulnerable countries on Earth. 21% of the population and 26% of the land area are below sea level. Although the large-scale coastal engineering and dikering system have mitigated much of the threat from the sea, uncertainties still remain with respect to the riverine flooding. Our study area, the Nijmegen, is targeted for these issues. And then this article has been published in the Journal of American Planning Association. Please use the link to access the articles. So to address this issue in the near and the long term, the Dutch government has applied a new method named the Room for the River instead of building higher and higher decks. So the Room for the River program has 34 locations, and our study area, Nijmegen, is the flagship project of the whole national mitigation program. So the major issue with flooding in the city of Nijmegen is the width of the river. In particular, the bottleneck is near the center of the city. It causes frequent and also heavy flooding. So what they are doing there is they first move the dike 350 meters inland, and they dig a channel for more room for the river to flow, which creates an island here. However, a lack of a coordination between the Room for the River program and the community network of spatial plans could be problematic. To looking at this issue, this study is applying the plan integration for resilient scorecard to answer two research questions. The first one is where integrated a Room for the River program policies throughout the Nijmegen network of plans. Secondly, how does this integration affect physical, social, and also environmental vulnerability to flooding at the neighborhood scales? So since its inception, the plan integration for resilient scorecard has been applied in research and then practice, and then has been deployed to evaluate hundreds of neighborhoods in over 15 cities around the world, including communities within the United States, the Netherlands, China, and also Japan. So this is a three-phase method developed by Berg and his colleague in 2015. Phase one is to delineate planning district and hazard zones. So in the city of Nijmegen, there are two different hazard zones. The embanked area, which is the area, the neighborhoods protected by the dike. You can tell dike line here. And then the unembanked area are the neighborhoods outside the dike, which make them more vulnerable to flooding. The phase two is to determine vulnerability. We determined three different vulnerabilities in this study. Phase three is to evaluate network of plans. We spatially evaluate 14 documents in the network plan system within the city, comprised of national level Delta plan, provincial level environmental vision plan, and the local level comprehensive plan, waterfront master plan, and land use plans. Each applicable policy is assigned a score of a +1, -1, or 0 based on its likely effects on flood vulnerability. So let's take a look at the overall policy scores. So first of all, the composite policy score for those 14 plans are all positive, ranging from +1 to +64. The unembanked neighborhoods received more attention on average for reducing risk, which is a good thing because those areas also tends to be more vulnerable to flooding. And secondly, let's take a look at the results of the plan scores by different administrative scales. So the light blue shows the result of embanked neighborhoods. The dark blue shows the result of the unembanked neighborhood. From the result, we can tell that the national and the provincial level plans generally give greater attention to the unembanked neighborhoods. The local plans place greater emphasis on the embanked neighborhoods, focusing on building flood resilience to accompany development. It appears that higher tier plans, national provincial level, are filling the policy gap in the development-focused local level plans. And then this is the result of the correlation between the overall policy scores of the 14 plans and then 3 different types of vulnerability. So for physical vulnerability, network of plans prioritize vulnerability reduction in the physically vulnerable area. However, for social vulnerability, plans do not target the highly socially vulnerable neighborhoods. For environmental vulnerability, the city of network plan supports reduction of environmental vulnerability reduction in the unembanked area, but not in the embanked area. And then this other results show the detailed correlation between individual plans, plan scores, and the 3 different types of vulnerability. And all plans support physical vulnerability reduction in both embanked and unembanked neighborhoods. All plans have inverse relationship with social vulnerability. The only exception is the comprehensive plan. The provincial environmental vision plans target most environmental vulnerable neighborhoods, while the comprehensive plan does not. There are several key conclusions of these studies. Compared to the US study cities, plans are more interpreted to enhance flood resilience. The network of plans targets the most physically vulnerable neighborhoods for increased flooding risk. Policy do not consistently target the most socially vulnerable neighborhoods, which is international issues. We also find a similar finding in the United States cities and also the cities in China as well. The unembanked area are target for the environmental vulnerability reduction, but they fail to do so to prioritize the same degree of policy attention to the same degree to the whole city. Thank you so much for your attention. Any questions? Thank you.
All right, thank you. Virtual clap. Or
Thank you all for having me. This is really nice to be able to share our work. My name is Kimberly Gill. I'm a senior research scientist at the National Center for Disaster Medicine and Public Health, which is a part of the Uniformed Services University in Bethesda, Maryland. The NDMS pilot program is new, and we haven't really had a lot of opportunities to share it publicly yet. So this is an exciting opportunity for us to begin to get our work out and definitely to develop some new research collaborations. So some of you may be familiar with the NDMS program more generally speaking. The NDMS is the National Disaster Medical System. And I think a lot of us who work in disasters are familiar with hearing about the NDMS responding to different types of events that we're more familiar with in the last couple of decades, things like hurricane response, even COVID response. The NDMS has been activated in a number of really interesting capacities. But what you may not have been aware of is that the NDMS was actually formed back in the 1980s during the Cold War, specifically for the scenario of a large-scale casualty combat scenario where, in the context of the Cold War and our relations with Russia, which eerily match present day political socioeconomic conditions. The program was actually developed with that kind of a scenario in mind, where we would have large scale casualties coming back from a wartime scenario. In more recent years, Congress was concerned about the readiness of the NDMS to actually be activated for its true intended purpose. And so where the project that the pilot project is coming from is in response to that. Congress authorized and directed the Secretary of Defense to conduct the NDMS pilot program, which will be conducted over 5 years, no more than 5 years, at no less than 5 locations. And I'll talk a little bit more about those in a minute. To be established in partnership with other public, private, and nonprofit healthcare organizations, and to be conducted in collaboration with the secretaries of those agencies that you see there. USU is designated as the lead organization to run this program, but it is definitely and certainly a cooperative and interagency dependent program. So the NDMS pilot program is specifically funded by the Department of Defense. It is separate from the actual NDMS program, which is run by the Department of Health and Human Services. And so the purpose of the NDMS pilot program is to strengthen interoperability, medical surge capability, and medical surge capacity to be able to care for our nation's combat casualties. That being said, if we do succeed at strengthening those 3 characteristics, we will also allow the NDMS to be ready for large-scale disasters or events that may result in large numbers of casualties, regardless of its origin. But considering the purpose of this particular program, the three-pronged mission is focused on the major components of the NDMS that are relevant to a combat casualty scenario, which involves federal coordinating center operations. Those are regional hubs that assist with dispersing patients to local civilian healthcare and other military and VA healthcare. Patient movement, the actual transfer and transportation of those patients, and then the true definitive care. So the research study that is proposed in the abstract that you all may have had a chance to read over it, I will also put the link to this paper in the chat. Was what we consider to be the foundation of the NDMS pilot program. This program started in September of 2020, and the first baseline year of the program was in fact this research study. We call it MCNIS, the Military Civilian NDMS Interoperability Study. And what this year-long project was all about was talking with key stakeholders, government officials, healthcare officials, other NDMS relevant stakeholders to identify what were the major themes and characteristics that came up with regard to a scenario like this. The data was analyzed into broad strokes, opportunities and weaknesses, sort of positives and negatives, where stakeholders were reporting recommendations for improvement. And so we see those as opportunities for strengthening, and then weaknesses or areas of concern that were targeted as priorities for this program or other agencies to address. The results from that qualitative work were translated into a stakeholder survey, which occurred in the fall of last year, and ultimately culminated in this validation workshop where we held a real-time hybrid, in-person and online consensus stakeholder workshop where we did electronic ranking, real-time electronic ranking and polling of respondents to further refine and sort the data. And that all led up to this current year's work, which we call the pilot implementation. So from September 2021 through the next years 2, 3, 4, and 5, the pilot is considered to be in an implementation phase. And that is where I would like to share a little bit more, especially with this group here, about where this work is taking place. So the idea of the pilot implementation is that it will result in scalable site-specific solutions that are locally relevant and provide value to increasing medical surge capability, capacity, and interoperability. These 5 sites across the United States are not really sites, they're regions. So they're not meant to be considered like just these cities that you see on this map here. But our first region is what we call the National Capital Region in and around Washington, D.C., Omaha, Nebraska, Denver, Colorado, San Antonio, Texas, and Sacramento, California. So that is just something I wanted to emphasize with this group in particular as we move forward, especially from the research perspective. We are definitely looking to build our research collaborations in and around these regions with any applied researchers who may have any interest in these broader topics of medical surge capability and capacity or interoperability. And so we've established some relationships with some folks at some of these sites. But for example, Siyu, you were mentioning you're from Texas A&M. And so although your work is obviously not specific to this topic, I would love to ideally chat with you at some point about potential, collaborators in that area. Our work will be ultimately evaluated, and the effectiveness of our pilot will be dependent on how well we meet that mission. And so we are looking for outcome-focused and applied research metrics and benchmarks to measure the effectiveness of the pilot program, especially to be able to compare effectiveness over time, as this is a multi-year project that will ultimately result in recommendations to Congress for expansion and ideally permanence. So I wasn't timing myself. I hope I did okay with 5 minutes.
All right.
But that's my contact information there.
Great. So thank you for having me. First of all, I am a PhD student at the University of the West Indies Seismic Research Center in Trinidad. That's in the Southern Caribbean region. So just here to talk a little bit about the role of communication and of course in disaster management and disaster advisory science, which is what we are primarily involved in at the center. So the Seismic Research Center monitors earthquakes and volcanoes in the English-speaking islands of the Eastern Caribbean. So if you all are familiar with the area, that's from St. Kitts up north all the way down to Trinidad and Tobago in the south. And so we are a regional body and we're responsible for volcanoes and earthquakes across different islands having different governments and different levels of resources and capacity. And as the scientists do the physical science monitoring the earthquakes and the volcanoes, we also have a very involved education and outreach team of which I am a part. Although my background is in physical science, I was a bit more interested in science communication, so that's where the bulk of my research takes place. So the research that I'm presenting here today essentially really was an in-depth look inside at how communication or science communication impacts the work of physical science. And what we found through our qualitative study is that there are several added benefits to just getting a message out. We are primarily involved in early warning. We recently had a volcanic eruption in St. Vincent and the Grenadines. So the bulk of our work is preparing governments and publics to face these things when they are likely to happen. And many folks think it's just about, hazard assessments and getting the message out there, and don't realize the communication process is quite an intricate one. So we see that communication, science communication, if properly executed, could add a lot of value to physical science, a lot of societal value. So given that the hazards that we study usually are very low frequency but high impact, there's the need for stakeholder engagement, and that is something a dedicated outreach team can do while physical scientists remain focused on hazard assessment. So there's that constant relationship building that has to happen to make sure that early warning systems work properly in the event of a crisis. Stakeholder engagement is easily facilitated or better facilitated by having a dedicated science communication team. During the crisis itself, having scientists explain very complex geologic processes to a panicked public is usually something difficult and something people can overlook. So having trained the science communicators, they're not necessarily to replace scientists, but to coach them, although some of them don't like it or won't admit that it's necessary, to coach scientists in explaining difficult concepts to a public that may be very scared or maybe facing something that is really challenging to them. One thing that our experience in the Caribbean and outreach team was able to assist with was capacity building. So the Seismic Research Center has several internships that we run at different levels, at the high school level, at the university level, involving students in internships and exposing them to research careers in the geologic sciences. It's very important. As a small region, there aren't many experts and there aren't many opportunities for persons to study these types of subjects. So it's important to introduce persons to these areas of research during their university careers so we could create new specialists and of course have that expertise remain in the region. So that's also something that a typical science observatory type organization may not specifically be able to focus on if everybody is concerned with the immediate physical science. And of course, we saw that there was a significant impact in terms of organizational credibility, in terms of getting information out, in terms quickly, on time, in places where people can find information easily and understand it. These things people often take for granted because some persons have it that as long as the information is out there in a language that people understand, whether it's English, Spanish, French, they should get it, but it's usually not that simple. So being able to use social media, to use community groups, to use influencers to get information across, this takes some practice and takes some time. And it's important that for your institution to invest in that communication expertise, to have the brand of your science advisory agency being all it can be, being a trusted brand, and having that level of credibility with the public and with other stakeholders. So the main challenge we have met in our work is stakeholders on the scientific side and also on the risk management side, not realizing that early warning, which is what we are primarily concerned with, and sense making in making people understand the hazard that they may be exposed to and the risk that they may face. This is a social process that involves taking information, structuring it within your social environment, the vulnerability, all these things that need to be taken into consideration could be overlooked. And during a crisis, this could have people misinformed in some cases, disinformed in other cases, and causing persons really to put themselves in more danger than they should be, because the persons having the scientific information and the risk information did not take the time to engage the social sciences professionals, persons in the humanities, to really communicate this information in a way that is useful for the average citizen, the average Joe, to make a useful decision on risk and on hazard. So that is all I came prepared to share today. I hope that we have some time for some discussion on especially bringing the physical sciences and the social sciences, even the arts together, to really get the message out in crises. And if you want to check out the full paper, it's open access. That's the DOI, and the link is in the chat. Thank you very much.
All right, thank you. Okay.
My name is Shintaro Bunya. I'm a research scientist at the UNC Center for Natural Hazard Resilience at the University of North Carolina at Chapel Hill. So I'm going to talk about the efforts to model small water conveyances in an operational storm surge model for more localized compound flooding forecast. So I'm talking about physical part of the natural disaster mitigation. So my research areas is simply the prediction of tropical, extratropical cyclone storm surges. So what I do is theoretical development and also the software development of the storm surge simulation engine, so-called ALSERC. Now, I also do a daily operation of storm surge forecast. And I have other experiences in tsunami simulations, also climate change mitigation adaptation, but I'm talking about storm surge part today. I just wanted to briefly introduce our storm surge forecasting system. At the center, we have the core engine, the ALSERC model that does the computation for the shallow water equations and to get the water level and the significant wave predictions every 6 hours. And it's managed by an automated solution generating system. So I don't really need to do so much things to keep computing the forecast. And so this system does that. And we consider the winds and pressure and astronomical type and river discharge. And we have a dedicated visualization web service. And also we are using the high performance computing environments locating across the multiple academic institutes. So our users of our forecast are North Carolina State Department of Transport, also Louisiana Coastal Protection and Restoration Authority, and DHS, and FEMA, and US Coast Guard. And then there are some more areas where we need more advancements in our forecast. So I listed 5 of them, but I'm just talking about 2 of them. So the first one is compound flooding forecast. So we have to consider the co-occurrence of multiple flood water drivers such as fluvial, and coastal. And then more information in less time. So although we are using high performance computing, we need more more information to resolve more detailed geographic features. Excuse me. To provide more localized or personalized forecast while maintaining computation time within a short period of time. We need to get the computation done within 2 hours. That's our goal for in-time information provision. So I'm going to show a couple of examples. The first regarding the Hurricane Florence 2018. So this is not forecast. This is a hindcast, but I want to share some theoretical advancements that we recently made. So Hurricane Florence was brought really strong winds and also enormous rainfall, and that made compound flooding at a number of locations, including along the New River at Jacksonville. This is a photo of Jacksonville, and it brought a storm surge greater than 4 feet. So we often reproduce the storm surges and compound flooding of this particular event. And this is one of the results that we recently got. So the challenge is to get the effect consider the 2 drivers. One is the surge from the coast. The other one is the high discharge from the river from upstream. So we were able to simulate the compound flooding around here that occurred during the event. So the dotted lines are the observation and the solid lines are our computation. And there is some gap, but we are doing a pretty good job, I believe. So the second example is, this is the picture of our operational grid, which has the 1.7 million nodes to cover this area. And one of the issue we have is, although we are using high-performance computers, we still need limit the number of nodes to represent the topography and the symmetry. So by proposing some numerical techniques, we are now able to embed a really narrow channel here, which is the 20-meter width. It could be narrower than this. So does it really matter to embed this narrow channel? It may not matter so much, but I do believe that it matters to model this narrow channel. So this is almost the last slide. As you can see here, so the narrow channel with width of 20 meters connects the 2 big rivers, News River and the Newport River. And although the elevation here is not so high, but the News River's water level is already high, so the water is coming from nose and it generates some floods here. So that leads the 12-hour advance inundation in this area, as opposed to the ones predicted by all the previous model. So this may lead to promoting residents to leave their houses at much earlier time. So this kind of localized information will be really helpful for the local residents living, for example, here to make a better decision making. So this is the last slide. Future collaboration areas with other researchers may include the prioritization in detailed modeling for more vulnerable communities, also climate change and/or other scenario development for planning, also risk communication informed with more localized, personalized forecast. Thank you for your attention. That's all.